We'll do 15 minutes on with the expert, and then there'll be a question time. So please email or text those questions in, and then we'll go on to the second expert, and likewise we'll finish up with some questions at the end. Aim to run for about 45 minutes, finishing the call at 2:15. Our last call, because of the interesting questions, ran on just slightly after that. For those of you who were on the call a minute ago, you'll realise that we are recording the call. So if you wish to see or wish to listen to the recording at your leisure after this, you can go onto the EBLEX website. In the Better Returns Programme section, you'll see teleconferences, and you'll find this and all the other sheep conference calls we've had on there as recordings. Okay. The one advantage of not being able to see everybody is not being able to see anybody who's late. So we'll kick off on time at 1:30. I'll hand over to Kate Phillips. Thanks, Kate.
Good afternoon, everybody. It's fallen to me just to talk to you really about the sort of final stage of pregnancy, probably the last month we're talking about now, and early lactation, and what we should be concentrating on is this last crucial phase of pregnancy. As ever, I'm going to remind you all to be condition scoring your ewes, because that is so important at this late stage. If ewes are slipping in condition now, then there is the opportunity to move them between groups, maybe a thin twin into a triplet and that sort of thing, so that we're ending up with ewes lambing down, hopefully for lowland ewes at about condition score 3, and for hill ewes about condition score 2 to 2.5. So the ideal time to be putting your hands on the back, of course, is when you're giving your Clostridial and Pasteurella vaccines, hopefully your booster at 4 weeks before lambing. So that would be a critical and crucial time to be checking that feeding is going well in terms of particularly on the energy front of really. So be also good to be keeping an eye on silage quality, and I hope if you've had your silages analysed or your hays analysed and your lambing inside, you've kept the best till last, and that will really help in terms of limiting the levels of concentrate supplementation you need to be going to. And everybody remember that once you're feeding more than 0.5 kilogram of concentrate, then it really should be split into 2 feeds. There's quite a lot of evidence to show that feeding large amounts of concentrates upsets the rumen pH, lowers the pH, stops the bugs digesting the fibre so well, and reduces fibre forage intake, and then ewes are more likely to lose weight in that situation, even though you're giving them a fair amount of concentrate. So really important, look at the diet carefully, make sure the quality of the silage is the best it can be just before lambing. Okay, so one, as well as condition scoring, there is one other thing you could possibly do is to check if the diet is adequate, is to ask your vet to take some blood samples from about 8 ewes, depending on your flock size, somewhere at about 3 weeks before lambing, to check whether the energy and protein levels are adequate. And the 3 key things that we look for are the level of beta-hydroxybutyrate, which is a byproduct of fat mobilization. And if a ewe is mobilizing too much fat, then the beta-hydroxybutyrate will be quite high in the blood. And we say levels of less than 1.1 millimoles per litre are normal. But once we get levels significantly above that, then it suggests that the ewe is being underfed, and we need to get some more energy into the diet. But it might not be that you simply just need to go in with extra concentrates, because initially you'd think, oh, just give some more compound feed, perhaps. But it's really worth looking at everything else that's going on in that shed to see if there's other things you could be doing. So one of the critical things I would be looking at is whether every ewe can get its share of whatever you're offering. So is there the 6 inches ahead trough space for ad lib forage, and is there 18 inches ahead trough space for restricted concentrates? If they can't all get their share because trough space is limited, then it's highly likely some older or maybe younger ewes aren't getting what they need, and likely that they may go down with twin lamb. The other thing you would be looking at in terms of the blood samples would be looking at the urea level. Now that would tell you if there's been a short-term sort of deficiency in protein in the diet, but it's very important when you're checking on the urea level in particular that the ewes haven't simply just been fed with a concentrate feed, because that could skew the figures. So have it as a sensible midpoint between concentrate feeds when they're a sort of a steady state, really. So look for that. That normal level is about 1.7 to 3 millimoles per litre. Anything much higher than that suggests we've got too much protein. Anything much lower, what we've got too little on a daily basis. The other thing that your vet would look at is the level of albumin, serum albumin, and that tells us really about more longer-term feeding of protein. So that might be helpful in terms of getting some more protein into the diet. So I wouldn't, as I say, largely just think, oh, I need to put in another half a kilo of concentrates, because if you're already feeding quite a high starch content concentrate, like a home mix based on barley or wheat or oats, then that might be counterproductive to add that extra starchy feed, and something more like beet pulp, which provides sugar and digestible fibre, or even an energy lick, would be more appropriate, I think, in those that last phase of pregnancy. So ask your vet to do a few samples if you are concerned at all, and get proper interpretation of the results. Don't just jump into feeding masses more concentrates. Okay, so that's at about 3 weeks before lambing. So what we're really aiming for, of course, is a ewe to lamb down with plenty of high-quality colostrum. And we know that feeding good quality protein has an influence, and making sure the energy protein requirements of the ewes are met properly. Because if you think about it, antibodies are made of protein. So if a ewe is compromised in terms of her microbial protein production in the rumen and her DUP, then there could be an issue in terms of the quality and quantity of colostrum produced. So we know that we need about 50 mils of ewe colostrum per kilogram of body weight within the first 4 to 6 hours of birth to protect that lamb against infections. Harriet's going to say quite a bit more about that shortly, but obviously it's a huge source of antibodies, and it's an essential source of energy and protein in the early hours of life. So if we're lambing outside, we need to be thinking about grass heights and what's available to the ewes. It's very easy for ewes to be gaining a lot of weight if they're put onto good spring grass to lamb, and it's really important that we don't let single ewes get too fat at that stage. So we need to adjust stocking rates at grazing for outdoor lambing ewes. So we may be putting twins on at 10 ewes a hectare and singles at maybe 17 to 20 ewes a hectare, depending on grass height. But the ideal grass height to be turning out to is 4 to 8 centimetres, and we need to restrict the intake of that for single-bearing ewes. There may be a need on some farms, particularly a lot of lay grassland, to be providing some extra magnesium pre-lambing, and some outdoor lambers have had to resort to magnesium boluses pre-lambing about 2 weeks before lambing to avoid any significant losses with staggers post-lambing. Okay, so after lambing, the ewe's energy requirements increase dramatically as she's trying to produce high quality milk and colostrum. Now, for a 70 kilogram mule ewe having twins, in the last week or so before she lambs, her full requirement for energy would be about 18 megajoules, but in early lactation, her energy requirements go up to 30 or more, depending on her body condition. Now, the 30 megajoules assumes that she's got enough body condition to mobilise some to supplement her diet, and thinner ewes would certainly need feeding better than fatter ewes because they haven't got the reserves to call on. So in terms of what a ewe needs to produce in milk, for a ewe with twin lambs, or lowland ewe, we're looking for 3 litres of milk a day. We very rarely think about milk yield in sheep like we do in dairy cows, but it's probably a good thing to think about that. And I know when I've checked on how much cade lambs are drinking on an ad lib system, they can drink 3 litres of milk replacer a day once they're a few weeks old. So it's a large requirement. The good news with a pregnant ewe moving on to lactation, before lambing, she can only eat, say, 2 to 2.5% of her body weight. But as soon as she's offloaded those lambs onto the, and they're walking about, her appetite increases dramatically, something like 3.5% of her body weight after lambing. So it's far easier for her to meet the energy needs of lactation from forage, especially if that forage is good quality spring grass. fresh spring grass can be over 12 megajoules per kilogram dry matter and over 20% protein. And if you think about it, that's almost equivalent to a good quality compound feed. So it can provide most of the needs for a ewe in early lactation because you can simply eat a lot of it and it's incredibly digestible. So there may be a need for supplementing if there isn't simply enough grass available. So we may need to be carrying on the concentrate feeding post lambing. I always think we have our ewes inside, or a lot of them inside, and then we expect them to adapt to a very different diet very quickly. They might have been inside on hay and concentrates, and then suddenly we tip them out to grass only. And it does take the rumen quite a few days to get used to a new diet. So I think some level of concentrate feeding is always a good idea to see them over the transition between their indoor ration to their outdoor one. So, right. So in housed ewes, we'd ideally be turning them out to grass of 4 to 8 centimetres, and hopefully keeping going a little bit with some concentrates. If we haven't got enough grass, then I would say it's actually well worthwhile giving about a half a kilogram of the same compound feed you're using pre-lambing to single-bearing ewes, and up to a kilogram for twin-bearing ewes. Thinner ewes might need more than that, but it's very hard to get more than a kilogram into ewes outdoors lambing, although a couple of winters ago I remember one farmer saying to me he'd actually put out 1.3 kilos all at once and the ewes had wolfed it down because there was so little grass. And actually after lambing, that sort of level of feeding in one feed doesn't seem to have the same impact it would pre-lambing, so it doesn't seem to have the same dangers. So what we're trying to achieve is a really good peak milk yield, trying to make sure that ewes are well fed so they reach a good peak milk yield at 3 to 4 weeks post-lambing. And work from Warwick University on mastitis has shown very clearly that ewes in poorer condition at lambing, those that don't have body reserve to pull on for a good lactation, are more likely to get mastitis. So I think what we need to be thinking about, if ewes are a little thinner than we'd want them to be, then they would need feeding concentrates for longer than a fitter ewe would do. In terms of grass staggers and in early lactation, for some farms it will be very important to be providing extra magnesium. Now that can be supplied as calcined magnesite within the compound feed, getting up to a level of about 0.7% magnesium in the compound, or providing magnesium in buckets, licks, or perhaps in water. And I always think it's a very good idea to be providing some dry forage, some dry hay or dry big bale silage, because the retention time of the big bale silage, the longer fibre, the less digestible fibre in the rumen, gives the rumen a greater chance of grabbing the magnesium out of the diet than it would if it's flowing through very quickly like high D value, high digestibility grass would be. So I think that's probably, Chris, about where I'd like to stop. I think I've covered most of the things I want to do. Yep, I think that's it. Thank you.
Okay, just before we go off the magnesium thing,
yep.
Can you just run over that again? So was that when you were talking about supplementing perhaps with some forage, some dry
yep.
forage, was that can you just run through that again, please?
Yeah, sorry. In early spring, grass can be very lush and rich and can have, sometimes if we put different fertiliser on, high nitrogen applications and high potash applications actually make magnesium quite unavailable to the ewe. And we need to make sure we provide extra magnesium in that situation, Chris, to meet the daily needs of the ewe. Because there's one or two minerals, trace elements that are really important on a daily basis, and magnesium is one of them. It's not readily stored in the body, and we need to be providing magnesium every day. Now, in terms of the digestibility of spring grass, it's very, very digestible. You know, we've got sort of 78, 80 D value spring grass, which is very, very quickly digested in the rumen and passes through quickly. And magnesium is absorbed through the rumen wall. So whatever's being eaten, if it's going through the gut very quickly, there's less chance of it being absorbed through the rumen wall. So if we've got something that holds up digestion, slows it down a little bit, then there's more chance of pulling more magnesium out of the forage than you would have done if it had just whipped through the gut very quickly. Does that? Okay.
Yeah, no, that helps.
Is that better? Sorry.
No, that just helps. Sometimes I think when you're listening, it's nice just to have something repeated. Yep. And the other question I had was regards, it was this issue of turnout, which I suppose is always a bit dependent on the season. And yes, we all know if we've got good grass available, the ewes should be getting everything they need. I was quite surprised at those high levels that you would recommend if grass is not available. Are there any circumstances you would consider sort of buffering with forage? I mean,
absolutely.
My experience is most of the time they don't eat it. If they've got anything on the floor, any grass to eat, they'll eat that in preference. Absolutely.
I mean, if there's less than 4 centimetres, we must continue with concentrate feeding. And in bad years, as I said, I've heard of farmers feeding up to even 1.5 kilos, which is a huge amount to feed. And I hope nobody has to do that this year. We get some good early spring growth. But yes, forage always, I think, Chris, it actually helps with that transition from indoor rations to outdoors as well, and if there's not much grass, they will eat the forage, but like you say, they often just search for every blade of grass they can before they touch that dry forage. But it very much depends on the forage itself. As we all know, ewes can be incredibly picky, and if it's a nice hay or a nice silage, they'll eat it, but if it's a bit mediocre, they'll turn their noses up at it. And of course, forage feeding would be preferable from an economic point of view, but maybe it depends on the quality of that forage, whether it's going to be good enough to sustain a good lactation, Chris, without concentrates.
And that, if you're in the situation where you're supplementing post-turnout with concentrates, I guess then you're just looking at sward heights, and once you feel the grass has come, you wind it down.
Phase it down. Yeah, I wouldn't ever take it out overnight, Chris. I wouldn't just say, right, 1 kilo down to nothing. It would be a gradual reduction according to how the grass is coming up. And we say, once it's over 4 centimetres reliably, then there shouldn't be a need for concentrates. But I would be taking it out steadily over several days rather than an abrupt change.
Yeah. Blood samples, Kate. I'm not going to try and say the word, but I think you call them BHBs, do you?
Yeah, beta-hydroxybutyrate. Yeah, that's it.
That's the one, yeah, thank you. I guess most people won't do that commonplace.
No, they don't.
What would the recommendations be if a vet was talking to you, or if you wanted to talk to your vet about taking blood samples? It may be one that Harriet might come to later on, but what's the recommended sort of numbers? I don't think you mentioned it.
I think I said about 8, Chris, but
8.
yes, I mean that will very much depend on the size of the flock, and I suppose I would generally recommend the more vulnerable sheep, the triplets and the twins, to be sampled rather than the singles. Although I do remember one instance when we sampled the single bearing ewes and showed up a protein deficiency in the ewes because we were looking at a diet of just hay only because of concern of the lambs getting too big inside the ewes and didn't want to give them many concentrates. But actually they were deficient in protein, so we could have ended up with limited colostrum and milk because those ewes didn't have enough protein. So I generally go for the more vulnerable twin and triplets that are more likely to succumb to twin lamb disease, but don't forget the singles because they might actually have a shortage of something as well. So so I would say, depending on the flock size, because about 8, I don't know what Harriet might back me up on that number, but the more you do, the more accurate your figure is going to be, rather than just if you did 2, that would be almost not worth doing.
And that's 3 to 4 weeks before estimated start of lambing?
Yeah, about 3 weeks would be ideal, I think, Chris. As long as you don't do it, if you only do it at 2 weeks and you get the results back, too late, then you can't really change anything. Yeah.
You mentioned thin ewes. I suppose in most seasons we're all used to back problem rather than fat ewes. And I think we did touch on this on the last conference call. In terms of managing fitter ewes, obviously you don't want to overfeed them. You've got more concerns. You've got different concerns with fatter ewes. But in that last few weeks up to pregnancy, you still want to get colostrum production, presumably from...
Yeah, with a fat ewe, Chris, they're much harder to feed than thin ewes. Thin ewes really have a very good appetite, and fat ewes tend to have a depressed appetite. They tend to have a lot of circulating fat in their blood. They may, be compromised, and I always think they've got a lot of internal fat. So they've got more pressure on the rumen. The rumens may be compressed even more than it would be in a thinner ewe. So the capacity to eat is less, but it is really important not to underfeed those, certainly in the last 3 weeks before they lamb, because otherwise you might end up with a tiny lamb out of a big fat ewe, because we've actually held back because of her poor condition. her fat condition, and the lamb hasn't actually got all it needed to grow well in the last final stage inside the uterus. So it is really critical if you're going to be slimming those fat ewes, that they're not slimmed down in the last month before they lamb, and you've got to be feeding the right amount, similar levels of concentrates you feed to thin ewes to make sure they have decent sized lambs and you've got decent colostrum.
And I suppose really the thing to do at this stage is, if you're noticing problems in the ewes, it's about making a record of that this year and putting something in place for next year. Body condition scoring, as you say, right through from weaning and tucking.
Absolutely right through, Chris. Every opportunity, I would say, but critically, I would say post-weaning, pre-tupping, scanning, and pre-housing, and so those are really, really critical times.
And that's something that I think we as EBLEX are really trying to encourage people to do, that from experiment work, from trial work that we've done, and analysis of data, the ability of managing our flock is so enhanced if we know what's going on with it, and the best way to do that, we haven't got a bulk tank of milk at the end of every day to assess how our cows are performing. Body condition scoring really is the best tool we've got, and using that as a management tool to manage grazing and feed availability and so on right the way through the season. So we will certainly be pushing that this year. Yeah,
and the interesting results, your recent project, Chris, on body condition scoring and showing how ewes that lose 1.5 condition scores in early pregnancy rear over ones that gain weight. Obviously, they rear heavier lambs, wean heavier lambs, and that shows that they actually had that body weight to mobilise, to use for lactation, and to rear their lambs faster than a thinner ewe would have been able to.
Yeah. So I think we'll move on to Harriet. I've got a question to come back to both of you on, Kate. So don't disappear.
No, I won't.
But if you want some more detail on what Kate's gone through there, a lot of what Kate said is covered in the ewe nutrition manual, which is on the Better Returns pages, and also the body condition scoring message is in, I forget the manual number, but it's on one of the later manuals there as well. So there's a lot of information on body condition scoring as well. I think we'll hand over to Harriet, and we'll look at some of the veterinary issues for the next few weeks for us to think about. Harriet.
Okay, thank you, Chris, and good afternoon, everyone. And I just thought I'd maybe start by just making a couple of observations on the blood testing used pre-lambing that you've been talking about. Really, actually, just to give people an idea of how much that might cost, because I know often people just think, oh, that's far too expensive, I won't do that. But although it does depend which laboratory is used, or whether vets may be doing it within their own practice laboratory, it's offered by University of Edinburgh, and they charge £100 for looking at blood from up to 20 ewes, so only £5 a ewe. So that is actually an incredibly good deal, because they're doing the BHB, albumin, urea, and they also add in magnesium, which actually is more of an indicator of calcium status, and copper levels as well for that money. So it's a really good deal. So it is something I would really encourage people to consider doing and speaking to their vet about. Obviously that £100 does not include your vet's fee for coming out and blood sampling the ewes and the postage and packing and materials and whatever, but it's just the lab fee. So that was just really to give people an idea. And they like to have a minimum of 5 ewes per group. So say it's your yearling twins or mature twins or triplets or whatever to look at. So moving on, I was just going to run through some of the veterinary issues at lambing time, and obviously I can't go through everything, so I thought I'd sort of pick things that I particularly see in my day-to-day work. Starting off just by addressing the issue of actual difficult lambings in ewes, and really a couple of main messages I want to get across here, which is firstly, when you've got a ewe that you know she's having difficulty lambing, it's to make a decision quite quickly as to whether you think that's something you're going to be able to sort out yourself, or whether you're going to need veterinary assistance. Because if you think you do need to get the vet or take the ewe to the vet, the chances of success are massively higher if you make a decision quickly rather than if you fiddle around for 50 minutes, 20 minutes, half an hour, and then decide you can't lamb her because she's gone through all that stress, and the chances of having a good outcome are very much lower. The other thing I wanted to mention was, a couple of things really. It's a really good idea to wear disposable arm-length gloves to avoid introducing infection in the ewe, and also perhaps actually for your own sort of safety as well, because several of the infections that cause abortions or stillbirth in sheep are infectious to people, so it makes sense really to wear gloves. I think it's pretty common practice that people would give an injection of most likely a long-acting penicillin to use that they've had to lamb, but I'd also recommend, as well as the penicillin, that you give an anti-inflammatory injection. There are several different types. Some of the common ones is phenidine or flunixin or metacam. They're actually the trade names, but these drugs reduce any inflammation and help to make the ewe feel much better. So people who started to use them generally find, even after a difficult lambing, the ewe tends to be up and feeding and much happier, much more quickly. So if that's something that you're not currently doing, I just ask you vet about it and have some by you for lambing time. I wanted to say a little bit about bonding between the ewe and lamb, and just relate it to some issues perhaps that I see. The main stimulus for the ewe to show maternal behaviour, I mean, if you take a ewe that's not at lambing time and offer her a baby lamb, usually she'll bunt it away and no way she's going to let it anywhere near her udder. But coming up to lambing, the change in hormone levels in the ewe, so progesterone levels fall, estrogen levels rise, that stimulates the production of oxytocin from the brain of the ewe, and then when the lamb starts to enter the birth canal, that further stimulates more oxytocin production, and it's this oxytocin that stimulates the ewe to behave in a maternal way, to lick the ewe, to bleat to it, to make little low noises to it, and to let it suckle. So the oxytocin levels will be high just coming up to lambing, and as you will all know, some ewes it's more pronounced than others, so some ewes are intent always on stealing someone else's lamb, but after lambing the oxytocin levels only remain high for a couple of hours. So it's in that period of 1 to 2 hours after birth that the ewe's nuzzling the lamb, licking the lamb. She recognises the scent of that lamb, and that imprints really strongly on her brain. And once the levels of oxytocin have dropped right off, she won't bond with another lamb in the same way. She certainly won't develop a really strong bond like she has to her lamb. So smell is really important initially. As time goes on, the ewe will recognise the bleat of her lamb, and obviously the lamb recognises the bleat of the ewe, so sound comes into it as well. But initially it's skinning that, initially it's scent that is really the main way that the ewe bonds to the lamb. And so that's really useful to utilise this. If a ewe loses her lamb, then skinning the lamb, putting the skin onto a foster lamb, usually results in the ewe accepting the lamb very, very quickly. Minimal stress to the ewe and to the lamb. So I just mentioned that because it's something in my experience that seems to be done a little bit less these days. People maybe are more tempted to put the ewe in a adopter crate to put a foster lamb on her, but that can be adverse to the ewe's welfare if she's left in an adopter crate for a long time. If the ewe hasn't accepted a lamb within 24 to 48 hours, she really probably isn't going to accept it properly, and it really isn't good for her welfare, or the lamb's welfare actually, to leave her in an adopter crate. So just to encourage those of you who aren't skinning dead lambs, that it really is a good thing to do. A little bit more on colostrum, which obviously Kate has talked about a little, but I'm going to mention it again because it is just so vital in terms of lamb survival. Colostrum is a source of easily digestible nutrients, antibodies and also acts as a laxative in the newborn lamb. From the energy aspect, lambs are born with a supply of energy in the form of brown fat, which lies around the kidneys and the heart predominantly, and that provides them with the energy to maintain their body temperature and seek the udder in the first few hours after birth. But compared with other species, lambs actually have a very small supply of energy, and this brown fat is quite quickly used up. So a lamb that's born outside in pretty inclement weather, maybe a bit of wind chill factor, the brown fat may only last for about 5 to 6 hours, after which time the lamb can't control its or maintain its body temperature. It'll become hypothermic, comatose, and then obviously die. So that first feed of colostrum is absolutely vital in providing a supply of energy. And the other reason for needing colostrum within the first few hours is that in the newborn lamb there are holes in the wall of the intestine which allow antibodies to pass through the intestinal wall and into the bloodstream. And because in cattle and sheep no antibodies pass across the placenta, it's different in other species. In some species antibodies do pass across the placenta, but cattle and sheep they don't. So the antibodies in colostrum are the only antibodies that lambs and calves get until they're old enough to make their own antibodies. And the holes in the gut that let the antibodies through start to close up almost immediately after birth. And by 6 hours after birth, they've closed significantly, and certainly by if a lamb hasn't had colostrum or had the antibodies within 12 hours, it won't be able to absorb enough antibodies. And that's it. Lack of colostrum is really the main reason why we see diseases like watery mouth, lamb dysentery, probably joint ill to a degree in young lambs. It's just really the very most important thing, an early feed of good quality colostrum. I was going to say a little bit then on stomach tubing, because if you have a lamb, maybe it's a lamb that's had a difficult delivery, it's got a big swollen head, you can tell that it's not going to feed by itself in those first critical hours. It's a good idea to give it some colostrum, and the easiest way really to do it is to stomach tube it. Allowing it to suck from a bottle probably would be even better, but generally people haven't got the time to sit and wait, so stomach tubing is a really good way of getting sufficient colostrum into newborn lambs that aren't going to feed themselves. But it's useful to think about where that colostrum is actually going. We're all sort of familiar with the idea that ruminants have 4 parts to the stomach, but in the newborn lamb, the only part of the stomach that is functioning is the abomasum, or true stomach. So that's the part of the stomach that is actually like our stomach. So the milk or colostrum needs to go into the abomasum. But when you feed an animal by stomach tube, it tends to go into the rumen. The thing that makes it pass into the abomasum, there's a channel called the esophageal groove, which is stimulated by sucking. So if a lamb's sucking its mother or sucking from a bottle, the esophageal groove closes and the colostrum milk passes straight into the abomasum. Given by stomach tube, it passes into the rumen. It's okay in a newborn lamb because the rumen is very small and underdeveloped, and the colostrum or milk flows straight from the rumen into the abomasum and doesn't cause a problem. But milk in the rumen isn't a good idea, so repeatedly stomach tubing a baby lamb with colostrum or milk isn't a good idea. It will start to lead to damage to the wall of the rumen. And something that's definitely contraindicated is if you happen to find an older lamb, maybe a 2 to 3 week old lamb, you find it and it's cold and obviously starved, don't give milk by stomach tube, because it will pass into the rumen, which by then is probably starting to function as a rumen. The lamb will be nibbling at a bit of grass and maybe a bit of creep if that's what you're offering. So you can by all means give electrolyte solutions by stomach tube, and that's probably a good thing because it may well be dehydrated, but don't give milk by stomach tube to an older lamb. If you're giving it milk, it needs to suck milk from a bottle. And that really leads me on actually to talking about the treatment of lambs that you find hypothermic, cold, probably comatose. You need to think about the age of the lamb and why it might have become hypothermic. So if it's a very young lamb, 2, 3, 4 hours old, and it's born outside and it's dreadful weather, or maybe the ewe hasn't licked the lamb properly, maybe it's not stood up, then the chances are it has literally just become cold and chilled. At that age, it should still have some reserves from its brown fat, so some reserves of energy. So it's okay just to warm that lamb up, and then once it's able to hold its head up, to stomach tube it or feed it with a bottle. If it's a slightly older lamb, maybe it's 2 days old and you found it cold and flat out, the most likely reason that lamb's temperature has dropped is because it's starved. It's basically suffering from starvation, and that's why it can't maintain its body temperature. Now, if you put a lamb like that straight into the warming box, the chances are it is hypoglycemic, as in it has a low level of glucose in the blood, and once it starts to warm up, it will go into what we call a hypoglycemic fit. So we've probably all seen these lambs, legs are flailing about, heads thrown back, and they just die. So the best thing to do with those lambs is to reverse the hypoglycemia first and then to warm them up. And the easiest way to do that is to inject a glucose solution into the abdomen of the lamb. If that's something that you haven't done before, probably the best thing is to speak to your vet about it, and they can provide you with a suitable glucose solution and show you how to do it. You basically hold the lamb up by its front legs with its head upwards and hind legs dangling down, and go in just to the side and just behind the navel and aim the needle towards the tail head and inject 10 mils per kilo of body weight of a 20% glucose solution. But as I say, you're best to really chat to your own vet about doing that. But that's the best thing to do for slightly older lambs that you find chilled. And then once you've done that, they can go into the warming box. And warming boxes are a far more efficient way of warming a lamb than just using a heat lamp. And very easily made. You can make your own just with some weld mesh on the floor, a fan heater, and some holes in the side and the lid so that you don't cook the lamb. And ideally, put a little thermostat in there as well, so so that you don't cook the lamb. Preventing disease in newborn lambs, well, as I've mentioned, really, making sure that the ewes are well fed so that they produce good quality colostrum, and then that the lamb takes colostrum in the first 3 hours of life. That really is the mainstay of preventing disease. Also have to bear in mind that whether an animal gets sick or not is often a bit of a balance between how big the challenge is and how much immunity they've got. So hygiene is very important. If lambs are born into a dirty environment with lots of bugs in the environment, then there's much more chance that they might get sick, even if they have had colostrum, or definitely if they haven't had quite enough colostrum. The practice of giving every lamb some antibiotics as it's born, whether that's oral antibiotics with a pump or injectable, is really not considered very good practice. These days now, there's a sort of a global concern about antibiotic resistance, antibiotics really not working. So doctors and vets are being encouraged to reduce the amount of antibiotics we prescribe and only to prescribe antibiotics for sick animals. So routine treatments like that are really not a good idea and should not be necessary if lambs have had sufficient colostrum. And in my experience as well, where farmers have had bad, say, scour outbreaks in baby lambs, antibiotics don't really seem to resolve these situations. You can try different antibiotics and the lambs just carry on dying. And unfortunately, it can be very difficult to resolve those situations that year, because the problem is likely to be new body condition, maybe there's disease going on, or feeding, poor quality colostrum, and that's why the lambs are going down with these infections so quickly. And obviously you can improve the feeding for later lambing ewes, but during lambing itself it can be very hard to rectify these situations. But antibiotics are usually not the answer. The best thing for navels is strong iodine, and preferably for the navel to be immersed in the iodine rather than sprayed on. But if you do spray it on, it's just a case of making sure you spray well and all the way around. But iodine is better than using, say, a terramycin spray. I've mentioned a bit about watering mouth. Joint ill actually is a slightly, or can be, a problem even where colostrum management is good. The bug that causes joint ill is called Streptococcus dysgalactiae, and it can live or likes to live on dry, clean straw. So you do sometimes see joint ill outbreaks in very well managed farms. But there has been one study suggesting that the infection might be spread by people lambing ewes without wearing gloves. And there is some sort of logic behind that, in that Streptococcus dysgalactiae is carried by some ewes in their vagina, so it is logical to see that you could maybe be spreading infection by not wearing gloves between lambing ewes. And the other thing that can be associated with joint ill outbreaks, tagging ewes at birth, and that can particularly be associated with a form of joint ill where the abscess is at the junction between the skull and the spine. So these lambs will go off all four legs, remain very bright, but off all four legs, and that can particularly be associated with tagging. But rubber rings are another way of infection gaining entry to the body. And I think it's important not to do things like put a load of rubber rings in your pocket and then take them out of there because they're getting dirty. Take them straight out of the box, clean each time. Lamb dysentery is a disease caused by Clostridial toxins. So vaccinating ewes with either Heptavat P or Bravoxin pre-lambing should prevent it. But obviously it's important then as well that the ewes produce good quality colostrum so that the antibodies are passed to the lamb. And just a final comment really on ewes that are sick post-lambing. Metritis means infection of the uterus, and this can follow a ewe having dead lambs or perhaps an assisted birth. And ewes are usually pretty sick when they've got metritis. They're dull, head down, won't eat, often won't drink, or might have their head hanging over a water bucket. And once again, giving anti-inflammatory drugs is really helpful, as well as antibiotics. And if the ewe's not drinking, she wants stomach tubing with some fluids and energy as well. But it's quite a difficult condition where prevention is definitely better than cure. And finally, mastitis, anti-inflammatories are really useful again here. So I think that's all I'd like to say, Chris.
Yeah, okay. So just quickly on the colostrum, conscious of time now, I read something, I think it was in the Farmers Weekly last week, about obviously ideally you'd like the lamb to have its mother's colostrum or colostrum from within your flock. But if you have to go outside, Harriet, what would you recommend? Do you advise these sort of packet stuff, or the point I read, which was of interest in dairy herds, if you could get colostrum from a dairy herd which has also undergone a clostridial program, but I'm not up on my dairy medicines to know if that's common.
I'd say it probably wouldn't be common, really. Quite a few cattle herds would probably use clostridial vaccinations, but more so in their young stock to prevent blackleg and things than in their cows. And there is another issue with dairy colostrum, although it is relatively rare, but some cows produce antibodies which will destroy the red blood cells of the lamb, so result in a fatal anemia. So what would I go for next? I think I probably would say dairy colostrum is probably the next best bet, but as cow's colostrum is less concentrated than ewe's colostrum, you really want to be giving twice as much, not in one go, but more smaller feeds. There is a slight risk that Johne's disease is very common in the dairy herd in the UK and can be spreading colostrum, so you could introduce Johne's into a sheep flock by doing that, so it's not without risk. And then your next option would be powder colostrum. So dairy would probably come slightly above the powder, but it depends on the dairy farm, really.
And presumably perfectly okay to freeze that sort of stuff, and any recommendations on thawing out?
Just to thaw it out very gently. You mustn't heat it because that will destroy the antibodies in the colostrum. So thawing it out slowly and gently.
So you'll frown if it's bunged in the microwave?
It can go in the microwave if it's put on very low in the microwave, but it will take time to thaw out. You can't thaw it out quickly, or you'll denature it.
Okay. Now, a comment perhaps that might bring Kate in as well. We've had a question from a lady who's experiencing what appears to be ringworm. Basically, she's working with Suffolk cross-texal ewes, and she's experiencing what seems to be a large number of ewes that are not dilating. They've been on a good ration, a 20% protein concentrate. So one question she's raised is, was that too good? Was that too high? But everything else seems to be fine. She sent some lambs off that died having got them out. So she's trying to get some feedback from the vet on that. But it's more a case of what could you do about ringworm, and is that a problem that she might have done through management, caused through management?
I mean, as far as is the 20% protein too much, Chris, I don't know unless I know what porridge she's feeding. So, it might have been excess protein, but I very much doubt.
Good quality haylage, Kate. Good quality haylage and a 20% protein, and she's feeding 0.8 of a kilo split into 2 feeds.
Yeah, but I still don't know what the protein level is, Chris, so whether the 20 is too much or too little, I can't really say just like that. But I very much doubt that has anything to do with the ringworm, so I will pass that over to Harriet, who deals with that sort of thing more than I do.
Okay, and I'm afraid I'm probably not going to have an answer. My experience, and I think this is pretty general experience really, is that these cases, it's usually very difficult to pinpoint what's causing it. And the next year, this is the only good thing to say to the ladies, the next year it's unlikely to happen again, but they, quite often will investigate looking for infectious agents as she's doing, which is good, but often you draw a blank, I'm afraid, and it's a bit of a mystery as to what's caused it. So,
thank you, Harriet. I didn't think I had the answer.
Okay. Yeah, there isn't really one, unfortunately. Or if there is, we don't know what it is.
Yeah. Moving on to coccidiosis. Producers had problems with coccidiosis in the past. Sorry, I'm just scrolling down through the screen here. Had a problem with pathogenic cocci last year. Should he be treating the housed ewes with anti-cocci buckets this year and follow up with a drench for the lambs once turned out?
Well, coccidiosis generally is a disease that comes about because of management systems. So it tends to occur where sheep are quite heavily stocked, often when lambs are kept in for a period, or maybe when conditions are bad outside, so it's muddy and wet and there's more stress and more contamination, I guess, of what's being eaten, because it's all sheep will shed some coccidiosis, and the best thing is for lambs to pick up a low level and build up immunity, and then they don't suffer disease. In terms of what's best, I would go back right to the start and look at the feeding of the ewes. Are they getting plenty of protein? Because if their immunity is depressed at lambing time, they will pass out more coccidiosis, which will then contaminate the environment for the lambs. I'd look at management, whether any changes could be made in management that might reduce the risk of the lambs becoming exposed, and then consider treatment. And I think really, Chris, I'm going to pass that back really, I'm sure this producer has discussed it with their vet, but it may be trial and error as well, what works best on their farm. I'm not always convinced that treating the ewes makes a massive difference. Making sure the ewes are well fed, I think, does, but not treating the ewes. And it may well be he does need to go in at a set time, probably about 4 weeks, when the lamb's about 4 weeks old, and treat all the lambs then. Or putting decox in the creep, if he's creep feeding, is another option. But it may well be a bit trial and error in that farm to try and work out what is the best way of controlling it.
And one quick word on worming ewes in terms of reducing worm burden.
Yes, try to leave some ewes untreated. So your fit singles would be the ones not to treat, and that's so as not to select too heavily for resistance. And then Scott's advice would be not to use one of the long-acting injections, because that will select more heavily for resistance as well. But really to have a plan with your vet as to what you're going to use each year. There isn't a blueprint as to what's best to do, but just those basic principles really.
But generally speaking, do we feel now that it's a good practice, this sort of post-lambing treatment at turnout, in terms of trying to reduce that pasture burden, given those provisos that you just have in terms of not doing singles and so on?
I would say yes, it's generally considered. It probably is helpful to be worming ewes at lambing or turnout to reduce the amount they pass out on pasture. But there would still be differences of opinion, because some people feel even if you do that, the worm egg count of the ewe tends to bounce back up higher again a bit later on. So, but the general advice would be to worm ewes at lambing or turnout, but leave at least 10% untreated. And it's better to worm them then. Don't leave it until, say, 4 to 6 weeks after lambing, because their immunity is starting to come back then, and that selects more strongly for resistance.
Okay, I'm just checking we've covered everybody's... one question on worming newborn lambs. What's the best time to worm newborn lambs? I suppose when's the sort of earliest time to worm newborn lambs?
Yes, well, the first risk is usually, but it depends year to year, from Nematodaris, and that will vary very much from year to year depending on the season. The Scott's website now produces a Nematodaris forecast, which is based on data from around the country of when outbreaks have been seen. So that's very useful to follow, because it may be some years you don't need to treat for Nematodaris at all, and other years you might need to treat more than once. So it is very much follow these forecasts and see what's happening.
And on product choice for nematovirus control, would you still go with, I'm going to show up my luck of ignorance, would you still go with a white or a clear drench? Or
yes.
Is that seek veterinary advice?
No, I think that would still be fairly standard to say it's one time when you can use a white drench, and probably is a good time to use a white drench because it takes the pressure off the other drenches. The only proviso to that would be if your first worming of the lambs is actually quite late, say something like the end of May, then other worms will have come through by then as well. So then at that point you wouldn't want to use a white drench because the other types of worms might be resistant. But if it's an early worming, a white drench is still considered probably a good choice.
Okay. I'm just going to give everybody notice that if you haven't already gone online to the flock calendar, I really do recommend you go on to www.flockcalendar.com. It's an online calendar we've created. You put your lambing or your tupping date in, and it's preset with a number of sort of treatments and management tasks which Harriet has helped us put together. So, for instance, it would remind you, as it did with me at home the other week, about our clostridial vaccines and the fact that we need to be doing those and boosters and so on. So you get an email through the post, an email in your phone or your inbox of the management task it's reminding you of, and you can put your own preset tasks in there as well. So if, for instance, you're using a vaccine like Footvax, which isn't one of the sort of regular tasks in there, you can bespoke your calendar. You can pimp your calendar, I suppose, is the way the young people would talk about it. So that's www.flockcalendar.com. Our next teleconference call will be a beef one on the 6th of March. So for those beef producers amongst us, please call in on the 6th of March. If you want a reminder for any of our teleconferences, please email us at brp.conf@eblex.ahdb.org.uk. For those people who want to know anything about our events, and we're always taking bookings for Live to Deads, and we probably slow down a little bit over lambing time because you guys are busy, but if you're interested in any of our events, the phone number for that is 01904 477 123. So I think with that, I'd like to thank Harriet and Kate. This is the third in our series, which we agreed to do up to lambing time. I would urge you, if you found these conference calls useful, to please give us some feedback. At the moment, we haven't got any more sheep ones planned for a couple of months, but we will be back later in the season, certainly in the summertime, with probably something on lameness control and worming strategies. So we will be back. We'll email you with details of those when they're confirmed, but we would appreciate your feedback as well. So thank you, Harriet. Thank you, Kate. You've been most informative. You've shared some of your experience with us, and we haven't had to travel, so that's been really nice. Friday the 13th, I wish you all well, and I hope the rest of the day is safe for us all. Thank you very much indeed. Thank you.
Thanks. Bye, Chris. Bye.